Hi there. I was on a Zoom call today with a bunch of our clients, and this one lady asks, she said she just got her blood work done. She just actually had joined our group, and she was worried because her doctor had run some blood work on her and come back, and she saw the results where her cholesterol was high, and she was freaking out because she just knew when she went to the doctor that with her cholesterol being up, her triglycerides being up a little bit, that he was going to want to put her on some statin drug to lower her cholesterol numbers. And she didn't really want to do that because she kind of clued herself in and realized that, this is a lifelong struggle with her. The stuff that she had tried in the past with the medications weren't working. They actually made her quite sick. Actually wound up with a condition called rhabdomyolysis, which is where her muscles were actually disintegrating. And those were one of the things that can happen. It's not very common, of course, but there's just over 900 studies showing that the damaging effects of these medications. And again, I'm not saying there's not a time and a place. I'm just saying that in this particular case with this woman, she just knew that she wanted to do something more that was healthy versus just changing a number on a piece of paper. And my big problem with the cholesterol is, there's a lot of them. Like, I've been doing what I've been doing for 36 years, and I've had the good fortune of having over 25,000 patients in that time. You can imagine the things that I've seen. One of them is this, from the time I graduated college in 1984, it was just, back then, if you had a 300 level on your cholesterol or lower, that was considered to be good to go, right? People were good. Doctors weren't freaking out over that. And then they lowered it to 250, and then they lowered it to 200, and now they're pushing people down to 150 in a lot of cases. What has it done in terms of heart attacks and strokes? Well, it really hasn't done a whole lot. In fact, 1/4 of our population over the age of 45 is on a statin drug, and heart attacks and strokes are still right where they were. But again, like I said, there's over 900 studies showing the damaging effects of taking some of these medications on our liver, and they're showing relationship between diabetes and women and taking these statin drugs. And now they're starting to come out with research relaying it to Alzheimer's disease because it's shutting off the production of cholesterol, and we know that our brain is 60 or 70% fat, and it needs cholesterol to be healthy, and we're shutting it off in the body. That's just one of the issues. And then some of the other things that we see, right, like 60%, or I think it was 50 to 60% that I had read, of people who have a heart attack or a stroke have normal cholesterol levels. And that should really open up our eyes, and we should look at that and be like, well, wait a minute. What good are we really doing if half of the people who have a heart attack and stroke have the cholesterol the way that it should be, or the way the doctors think that it should be? Here's the analogy that I use. God gave us cholesterol, number one. 70%, some people say 80% of the cholesterol in our body is produced by the liver. When you eat less cholesterol, guess what happens? Your body makes more of it. When you eat more of it, your liver makes less of it. That should tell us something right there, how important it is, right? Our hormones need cholesterol. Our cell membranes, the brains of our cell, the membrane is made of 2 layers of fat, largely cholesterol. Our brain is made of partly cholesterol. So, and it's just essential for life. If we didn't have cholesterol, we would all be dead. It's not the boogeyman. And that's the big problem that I see, that we've been trained now to look like cholesterol is our enemy, and nothing could be further from the truth. The analogy I was starting to say is that if you would drive by an accident, a car accident, and you would see an ambulance there, and then that happened again and happened again, there might come a point, if you weren't aware, you might start to think, my goodness, like, those ambulances must be causing car wrecks, because every time I see a car wreck, I see an ambulance. We're not understanding that the ambulance is responding to the accident, right? The same with cholesterol. When you see cholesterol built up in your arteries, it's your body responding to damage inside the artery. Inflammation in the artery is causing it needed to be fixed. Well, what does your body do? It sends cholesterol in as a patch. But when you stay inflamed all the time, your body's rushing cholesterol there. Yeah, it can build up and it can occlude the artery, and that is a problem. But the cholesterol's not the problem. Cholesterol's responding to the problem. So we've got it all backwards, and that's why just dealing with cholesterol is not making a difference. That's why all the studies show that it doesn't matter what you do with your diet with cholesterol. It's not making a difference. So if you want to know more about this kind of stuff, if you want to know the truth as it relates to health, why we're getting sick, and how we need to what we need to do to help ourselves get better, which is address the root cause of what the real problem is, really. We need to start addressing root causes instead of just merely patching over symptoms. If you want to know more about that, go to coleclass.com. We have a lot of good information there. It's a great place to start. ColeClass.com. Hope to see you there. God bless.